So a little story here. There once were two Frenchmen. In the 1800s, the French chemist Louis Pasteur popularized the germ theory, proposing that microorganisms are the cause of most diseases. Pasteur's claim it's the germ that causes disease. By contrast, Pasteur's friend, physiologist Claude Bernard, taught that the terrain of the body was more important than the pathogens that infect it. Claude Bernard, no, Louis, it's the condition of the host that matters. And they were friends. Le terrain est tout. Whoever speaks French, I don't know if I pronounced that correctly, but le terrain est tout. The terrain is everything. For this reason, it is said that on the deathbed, Pasteur admitted Bernard was right. The pathogen is nothing, the terrain is everything. Okay, so let's look at that a little bit more. Enhancing the condition of the host of your terrain, the condition of your host, of your body. So just before we get into supplementation, just considering eating a healthy way, eating less processed foods helps with the condition of a terrain. Hydrate well, reverse osmosis water is what I recommend. Again, there's controversy again with diet, with what we drink. There's thoughts back and forths, but just to highlight some things that I recognize. Finding your balance with rest and activity. Again, lifestyle factors is a key. Exercising in moderation. Too much exercise can be a concern, and not enough can also be a concern. And then balance your autonomic nervous system. Find your calm. Find the things that bring your heart to a sense of rest, of peace. That's the number one factor. And with my work, I recognize how we address stress is our highest leverage for our health. And then considering nutritional supplementation. So today we're going to be focusing on considering nutritional supplementation. Supplements to enhance your terrain. Number one, minerals. Now, minerals provide, you can say, essential for electrical charge of the body. So there's something called macro minerals like calcium, magnesium, and there's micro minerals like selenium and other things too that actually help assist the body to be electrically charged. So for all of us, Alan, you asked me what supplements I take. Every day I take a mineral supplement in order to assist, to provide my body, my terrain, that. Antioxidants. Now, some of you mentioned about vitamin C. Antioxidants prevents the loss of electrons. So again, if you don't remember your biochemistry way back when, it prevents the loss of electrons, which relates to our energy. And in the way the world is now, because of stress, things can oxidize in an accelerated way, like oxidating. If we have an older car, our paint oxidizes. It's the same thing with our body. If we don't have enough electrons, we're going to be looking older than we should before our time. Intestinal support, another third area to support. So vitamin D plays a key part in this. Vitamin D assists to regulate intestinal barrier integrity, which influences the immunity in our gut. It's so important. So there's something called, you've heard maybe of leaky gut, intestinal permeability. So when our cells in our small intestine aren't properly integrated, they open up spaces that allows for things to get into our bloodstream that shouldn't be getting in, which can set the stage for autoimmune type conditions. And vitamin D helps to prevent that. It helps to keep our cells integrated healthily together. So it's important to monitor your D levels and to take it with K. Now, the reason why I say that is because when you take it with K, it helps to direct the physiology to, say, deposit calcium where it needs to be deposited, but not in other areas where it's not meant to be deposited. So there's an important combination of taking D with K. Number 4, essential fatty acids. Now, omega-3s, they're good for your brain. They're anti-inflammatory. There's fish-based omega-3s, and there's seaweed or algae-based. Some people aren't interested in taking the fish-based ones. Okay, and number 5 is consider toxic binding support. Now, I don't know if you've heard of chlorella or modified citrus pectin. Form of that is pectisol. Now, because the world is so toxic and a lot of health conditions, Truman, if you can mute your mic, it'd be great. If you guys can mute your mics. So considering a toxic binding supplement to help with your terrain. And chlorella is a well-known one. And there's something called heavy metal toxicity. And there's a lot, it's a large subject, and there's heavy metals that aren't really healthy for our body that are circulating in our air, in our water, in our food. And if they get into our system, they can interfere with enzyme systems that relate to our metabolism. So it's important to help address that on a daily basis. And if you have any questions, again, write them down and we'll consider them after I go through these few slides. Choosing supplements. Okay, read labels for main and other ingredients. Watch out for food and other ingredients. Watch out for food dyes that are in other ingredients, or glycols, or titanium dioxide. Titanium dioxide, a safety study assessment conducted by the European Food Safety Authority in 2021, concluded that titanium dioxide ages DNA and can harm the immune system, resulting in its ban in the European Union in 2022. So look on your supplement bottles and see if things like this are in them. And you want to buy a supplement to take that don't have these ingredients. So titanium dioxide, we're talking about, it's a whitening agent. And there's a product, product Nature's Bounty. You've probably seen them at different stores, Walmart, even CVS there. And the label there has D, it has calcium, magnesium, zinc, but then other ingredients. It has less than 2% of titanium dioxide. And you may think, well, less than 2%, what can that do? Actually, in the research I've looked at, they talk about less than 1% titanium dioxide. But if you can get a product without it at all, it's going to help overall your terrain, the condition of your host. Individual specific supplement recommendations. So generally those five categories: minerals, antioxidants, vitamin D, essential fatty acids, and some kind of binding agent. But if you want to be a little more specific for your individual needs, this is where lab testing is used. So blood lab testing utilized to determine your specific current nutritional needs. So your labs can tell us currently what your nutritional needs are. So monitoring vitamins like A, D, E, K, B, B12, you can say, folic acid, short-chain fatty acids are helpful to see. And also utilizing your routine lab testing. I'm sure most of you have your CBC taken, or your CMP values taken, so they can be seen to actually see what supplements might be helpful to address those results. And additionally, checking for other factors like CRP, C-reactive protein, which is an inflammatory marker, ferritin, your iron stores, A1C, your blood sugar, and other factors too. Now, a little story with my CRP. When I had before my surgery, actually, my CRP was 99. The usual range is less than 0.3 there, and my range was 99. It was the highest my doctor had ever seen, and my body was racked with pain, so much so that I couldn't work for a year and a half. I had severe joint pain in my left hip, and we'd be driving in the car, and any little bump would set me off almost screaming in pain, because my body was so vulnerable with a high CRP number. But I didn't know that until I had that taken. And I really didn't know what to do for that. I was getting steroid shots under X-ray, and nothing was touching the pain until I discovered curcumin. And once I started taking curcumin, my CRP levels greatly reduced into more optimal ranges, and I was able to go back to work within 3 months once I started taking it. So a little story on my part. So if you are having severe joint pain, you may want to get your C-reactive protein checked. Okay, now that's current needs. Now genetic testing, again, this is some work that I've been getting into. Genetic testing to determine your lifetime genetic needs. Okay, so lifetime genetic needs relate to there's certain things within each of us that might be compromised genetically. So let me explain a little bit more, and I have a little overall program I've recommended for a patient, but I'll take it through step by step. So this is for a patient I developed a program for. So you just follow my cursor so you don't get overwhelmed by what's on here. Supplement recommendations to support genetic needs this is for one of my patients. And it was found through the DNA testing that I do. And again, with DNA testing, some people kind of have a red flag when they hear that because of security concerns. But again, the company I work with, I feel assured they don't sell data. So we can talk more about that if you like. But anyway, for this patient, it was recognized that they're compromised with methylation. Now, methylation is something that your body needs to keep inflammation down. And there's two essential supplements to help with methylation, especially if you're compromised. It's B12 and folate. Now, with genetic work, though, it can tell you which type of B12. And most B12 in supplements now is methylated B12. But for this person, they needed adeno B12, which is non-methylated B12. But for their folate, they needed methylfolate. So these are two important things that work best for this person to help with methylation or to keep inflammation down. Now, they're also compromised with detoxification. Now, when you're compromised with methylation and detoxification, that means when you have, say, inflammation in your body has less ability to detoxify that inflammation. And for them, assisting them to take something to support those processes is something called, say, liposomal glutathione. But there's other assistances in that respect too. For this person also, they were compromised with vascular inflammation. That means they tended to have more, they could tend to have more inflammation in their vascular system. And to help address that over their lifetime is taking something like a natto-E, vitamin D. Now, a natto-E is from tocotrienols rather than tocopherols. So there's different types of vitamin E. Blood sugar, they were compromised, and this patient had diabetes. Their A1C, when they first came to see me, was like 7.7 or close to 8, and helping to assist them over time, taking a product to support with that can kind of assist along with if you need medications. Microbiome support they needed. So there's something called Megaspore. Some folks take probiotics, and Megaspore is a spore-based probiotic that's not broken down in the stomach that can survive into the large intestine, and it helps the body produce its own probiotics in turn. Vitamin D and K, again, is so important for our microbiome, our intestine. And then additional supports. Mega Pre is a prebiotic. And Megamucosa, if you're having, say, stomach issues, this helps to help repair the intestinal mucosa of the intestine. And omegas. Okay, stress. Again, this person had more of an aptitude for having stress. So there's something called L-theanine that can help with that. Monitor for other products. Deep Calm, magnesium can help with that. And they also had celiac, or they had non-celiac gluten sensitivity. They didn't have celiac genes, but they had non-celiac genes here related. And so for them, eating gluten could be an inflammatory response for them. So there's something called wheat rescue they can use as needed for suspected gluten-containing meals. And then lab monitoring. Now, because they were certain compromised with genetics there, checking their B12, folates, A, D, zinc, magnesium, CRP. So these are areas to check for this specific person because they had vulnerabilities with actually these nutrients being properly utilized. And then inflammation, homocysteine is an inflammation marker for the cardiovascular system. Blood sugar levels. I don't know if you've heard of galactin-3, relates to inflammation and fibrosis that may develop in our body. Checking hormone-wise. So again, it gives you an overview in terms of what you may need or what that person might need for their lifetime. Okay, and how you take your supplements. So you take your supplements with wellness intention versus gulping them down. So when you are taking your supplements, like this person smiling here, be glad you can afford the supplements. Be glad you've learned something about taking supplements, and having an intention when you do take them. Take most with some food for best use. Again, vitamins are coenzymes. They help with assisting with factors in our body for our metabolism. Vitamin D and K, for example, is best to take in the morning with a fat-containing meal for its proper absorption. And for those with compromised vitamin D genetics, you may have to take it twice a day to reach optimal healthy levels of 50 to 70 versus clinical 30 levels. So again, with some of my work, I look at healthy levels versus clinical levels. And so there's a different range. Clinical is what conventional medicine is looking to see, have at least to prevent disease, but I'm looking to see how to optimize individuals' healthy levels. So levels of 50 to 70 are ideal to have for vitamin D. And you can take too much D. That's why monitoring your levels is so important. Okay. If you would like assistance, I'm glad to help with your supplementation interests. So I can give you access to professional brands that don't have the titanium dioxide through what's called Fullscript, which is a virtual inventory, versus buying them in a store or on Amazon. Now, one concern with Amazon is you want to make sure you're getting it direct from the company, but you don't know if Amazon is storing that product in their warehouse, or even there's a possibility of having counterfeit supplements through ordering through Amazon. You can contact me at my number, 404-316-7081, or at my email address there, Dr. Steve Ventola at mindspring.com. Just set up a complimentary consultation. I'll be glad to do that for each and every one of you.